I am Dr. Lalit Mani and welcome from Delhi Orthopedic Association. I am the president of Delhi Orthopedic Association and also the editor-in-chief of Indian Journal of Orthopedics. Today, I would be sharing certain facts and thoughts about vitamin D deficiency in Indian women, trying to bring out what is the current status on this particular problem. Now, if we Google the status, we would have a huge pile of information which comes out, and the media is full of news on such catchy titles like Urban India has a huge vitamin D deficiency problem as people hide from the sun. Although the data would be missing for the last 1 year, however, before that, we do have a lot of evidence on this particular fact. So just recollecting some facts about vitamin D. It is formed in the human body, in the skin, once we are exposed to the sun, from 7D hydrocholesterol to cholecalciferol. It gets activated in the liver and then in the kidney. It does come from the diet also, although the vegetarian diet is extremely poor on vitamin D sources. The best is what we get from mushrooms. So what causes deficiencies? On the left are enlisted a few facts which block the sunlight from giving us the power of conversion of vitamin D in our skin, which is using sunscreen, the melanin in our skin, high altitude, winters and air pollution. And there could be multitude of other factors like medication, liver, renal or nephrotic syndrome or obesity, various other intestinal malabsorption syndrome, and then it could be associated with various other diseases, and it could have manifestations on various other systems. So having a bird's eye view of the global scenario. Now this is a map which shows that there is a huge orange and a red which is covering most of the Asian countries. So the vitamin D status in adults of more than 18 of age group is visible in this, and you can see that it is rampant in Asian countries. If you further look at what data is available, you can see that there is a mixture of this problem in cold countries and in Asian countries. You can see a very high figure in Mongolia, which almost reaches to 98, and Northern Europe, which almost reaches to 92, and then in Middle East, where it reaches to 90. So what is the Indian scenario? This is a graph which represents the scenario from the age group of the elderly to the newborn, and we can see that the adolescent is one area where the deficiency is the maximum. And by the knowledge of peak bone mass, we know that this age group is a very vital age group for us to develop good bone health. The numbers show a bright picture, at least in the lactating women and the pregnant women, which might be a consequence of various healthcare activities which are happening during the antenatal period and the postnatal period. However, the incidence again rises in the adults, which reaches somewhere around 90%. So this is a rough figure on what is the reality in the Indian scenario. So if I have to summarize what is the current status of Indian women on vitamin D deficiency, the literature evidence tells that it varies from 50 to 94% depending upon which age group we are looking into and what are the tools we are using to evaluate this particular problem. I'll talk a little more about the tools as we move further, but let us look why it is happening. There are various hypotheses which have been postulated, and a few I am depicting here. Increased indoor lifestyle, thereby preventing adequate exposure to sunlight. Changing food habits contribute to low dietary calcium and vitamin D intake. Phytates and phosphates, which are present in fiber-rich diet, can deplete vitamin D stores. And increased skin pigmentation and application of sunscreens. Cultural practices such as the burqa and parda system, and unspaced and unplanned pregnancies in women with dietary deficiencies. So these are few postulates which have been the cause of a very high incidence of vitamin deficiency, D deficiency in our Indian women. So how do they present? They could be presenting with various types of symptomatology like excessive sweating, mood swings, tiredness and fatigue, muscle weakness, high blood pressure, digestive problems, dry skin, overweight or obese, and bone and joint pains. So if you sit back and think about these symptomatologies, these are very, very common occurrences in our families, in our peers and colleagues, and we always wonder on what could be the cause underlying these. So remember, vitamin D deficiency could be one of the baseline cause of various of these symptomatologies which the women present with. So the thing I was talking about, the tools which we use to evaluate a deficiency of vitamin D. To diagnose a deficiency, we need to have a tool, and the blood estimation of vitamin D level could be one of the best tools. There are various ways of estimating this level, and then there are various parameters which define a cutoff of a deficiency versus an insufficiency versus a sufficiency in vitamin D. One of the commonest followed parameter is less than 20 nanogram per ml in blood is defined as vitamin D deficiency. This is the commonest which has been followed in Indian population. However, this is still not standardized as the ultimate tool. Now, this comes from Journal of Family Medicine and Primary Care as early as 2018. This is a publication from All India Institute of Medical Sciences. And I picked out two charts which are very interesting in this publication. The first table is community-based studies on the prevalence of vitamin D deficiency. Remember, it is looking at all the studies till 2018. And the first table talks about the community-based deficiencies, meaning they have looked into the patients in the community. And let's look at the most recent ones, which are on the top. You can see the sample size is huge. The first study, which is from West Bengal, talks about 200 patients, and second is which is from Ballabgarh, close to Delhi, is almost 400 patients. And what comes out? What comes out of the pooled data in this review article is there is a huge amount of deficiency in rural population, in the rural women. And the next is the figure down here, which is the urban female adolescent. Of course, there are other data, the 88% in the rural female and the 82% in the post-menopausal female. The second table is about the hospital-based study. And interestingly, you can see that this article of 2016, which is from Delhi, looks at 400 primi gravida, and the incidence is almost 93%. And come down to this, the pregnant and the lactating. Now, this is at hospital-based study, and it is almost reaching 100% mark. Another paper, which is 2018, and it is from the International Journal of Reproduction and Contraceptive Obstetrics and Gynecology. This is a study from SN Medical College, Agra, and it is looking at the prevalence of vitamin D deficiency in Indian women. The study has a systematic review of 1,052 patients, so it's a huge database. And according to the cutoff set up internationally, about 65% Indian women are having severe deficiency of vitamin D. In fact, less than 1% Indian women are having a vitamin D sufficient value. So you can imagine this is a data coming out of SN Medical College, and which is in the northern part of India. Now the most recent studies. Now this is a article from International Journal of Health and Clinical Research 2020, and it talks about an observational study to assess the prevalence of vitamin D deficiency in Indian women. I picked out two tables from this manuscript. The table one is talking about the demographic profile, and interestingly, they have looked at almost 900 people, and below the age of 30, we have a huge cohort of 500. And you can see that the deficiency is almost in 68%. The table below is interesting. Here it talks about the severity of the deficiency. That means below 20, 20 to 30, and above 30 nanogram per ml. And you can see 65% are deficient. Another recent paper, which is 2020 from Journal of Family Medicine and Primary Care, again a huge cohort, about 1,260 women presenting with fatigue to OPD. About 1,227 women have vitamin D deficiency, and about 1,200 women completed the study and responded to the vitamin D therapy, meaning presenting complaint was fatigue. They were given vitamin D therapy and almost all responded. So you can see the high incidence of this problem. And the final manuscript which I want to share, which is almost 2021, the most recent, it is from the Indian Journal of Endocrinology and Metabolism. It comes out from JIPMER, Pondicherry, and it's an excellent systematic review. I would recommend this article. Most of you should go through. It's a huge database. Look at it. 5,969 females have been looked into, and almost 1,194 post-menopausal have been looked into. So this is a huge systematic review, and the most recent one and the conclusion are really interesting. Let me read out the whole conclusion. The present study shows that vitamin D deficiency is prevalent among apparently healthy Indians living in different regions of India, irrespective of the exposure of sunlight, as per the current Institute of Medicine recommendation of normal vitamin D level, and the deficiency is commonly seen among the Indian, regardless of age, gender, menopausal status, residing in rural or urban areas. So it is a very, very interesting manuscript which brings out the fact that it is rampant in the Indian women, and it doesn't affect whether you're from the north or the south, the rural or the urban, and the age is also not affecting it. It is there throughout in all ages. So what is the future? I think the future lies in fortification of food, supplementation, education, and awareness. Delhi Orthopedic Association has been keen on this topic, and we have been working as a society to contribute to address this problem in our population. We've been acting on two major points, and they are awareness, and second is catch them early. Under awareness, we have a regular activity every year, which is called the Bone and Joint Week, which happens throughout the country. In fact, it is a nationwide initiative by Indian Orthopedic Association, and each state chapter keenly participates in a week-long activity. Now, the theme of the week can change every year, but bone health is one of the basic things which is there every year. It is very commonly alternating between bone health and road traffic accident almost every year. And this week we have chosen as a bone and joint week because the Indian Orthopedic Association was registered in August, and the first week of August is uh, contributed throughout the country on the awareness program. And vitamin D deficiency for the past few years has been one of the cornerstone areas which we have been working on. Delhi Orthopedic Association does various webinars, CME programs, orations for its member. It has a very, very strong and a vibrant journal which talks about this particular topic very regularly. We also have, you know, talks which are there for the common society during this week. We have various activities which happen, which is put into the print media as well as the social media or awareness. The second thing which Delhi Orthopedic Association has been acting active upon is catch them early. We have been promoting on diagnosing this particular problem in our outpatient departments, in our inpatient departments, as well as we have been very active on catching them early on treating the problem, meaning educating them about exposure to sunlight, taking supplements, and dietary guidelines. So it's been an initiative which will show its effect in years to come. However, we would be strong going on the awareness programs on identifying this problem. Once identified, I think it is half done, and we can take care of this epidemic which is looming. So thank you very much for the attention, and I hope I have been able to bring out this fact that vitamin D deficiency in Indian women is rampant through all ages, through all strata of our society, and throughout the nation. Thank you very much for your attention.